This video pitch contains the solution of cervical cancer screening participation. The target audience is women who are unable to attend the cervical screening during the normal working hours. Therefore, the idea of a mobile application, Med Delivery, was developed. Our client is Queensland's Government Department of Health, with a purpose for encouraging participation in cancer screening programs. Therefore, high levels of participation are needed to improve and protect the health of Queenslanders and to maximize the benefits and effectiveness of cancer screening programs. As eligible women can get cervical screening tests from health clinics or services, with their opening hours generally coincide with regular working hours. Therefore, women who are in full-time employment are not be able to get the test during their working hours. The problem statement is then addressed as, how might we make cervical cancer screening more accessible to women who are unable to attend cervical screening tests during usual clinic hours? Women comprise around 47% of all employed workers in Australia, with around 25% are women working full-time. There were a concerning drop in GP visits and pathology testing among women for essential health checks due to the impact of COVID-19. National trends show cervical cancer screening rates fell by 67% in April 2020 when compared to pre-COVID data. Therefore, the cervical self-collection may increase the cervical screening rates in Australia, as eligible women can collect their own sample of cervical cells for HPV testing and send it directly to a pathology laboratory. There are three trends involved: craving convenience. COVID-19 pandemic has been changing consumer behaviors from always available to pre-planned actions. Walk-ins are less practiced as they need to plan before getting to receive a service or making a purchase decision. Playing with time. Newfound flexibility provides more time for consumers. They thus prefer to stay home and travel less. Patient engagement. Patients can make a final decision in their own health, and doctor is a part of a team nowadays, which is different from the past that the doctor was the boss and decided everything for their patients. May is a 37-year-old Thai female currently living in Brisbane. She works as a digital printing operator on Monday to Friday, starting from 8 a.m. to 4 p.m. She needs to take good care of her health as she used to have a problem with her back. Having a healthy life without illness on both physical and mental health is her goal. Moreover, she expects to be able to access to a health checkup and attend a cancer screening on the weekend or after-hours clinic. She also prefers a consultation with healthcare professionals in order to ask questions to understand clearly about her health, as she is not a native English speaker. She is worried that if there is no employment available on the weekend, she will not be able to have a screening because she doesn't want to leave work during the working days. She will be embarrassed if the specialist who operates tests for her is not a female. About her gains, she can have a cervical screening test without asking to leave work. She can monitor her health for free in order to look after her health properly and can have a consultation with a doctor about her health. There are two concepts of the prototype, which are Medivan and Med Delivery. Concept 1. Medivan is a mobile van that can offer cervical cancer screening within the van at any convenient locations and time. Instead of walking into the GP clinics, personnel can ask for the Medivan to come to their places. The van will have a healthcare provider and the tools for the screening. This idea can solve the problem of lacking time to participate in the screening at the clinics. However, this might be costly to practice, and the risk of COVID-19 infection needs to be considered. The selected concept is Med Delivery. Med Delivery is a mobile application that helps cervical cancer screening more accessible among women who lack of time to get a test at the clinics. Instead, eligible women will get the self-collection to collect the HPV sample by themselves at their home. There are two main functions of this app, which are teleconsultation and requesting for a cervical self-collection. Personnel will need to select to have a consultation with a specialist provided. After booking an appointment, they will need to join the consultation via video call to get assessed by the specialist whether they are eligible to get an HPV self-sampling for cervical screening at their home or not. If they are eligible, the doctor will allow them to request for the self-collection. After that, the self-collection kit will be posted to their home. The doctor will explain the guideline on how to take their own sample for an HPV test during the online consultation. After collecting their own sample, the personnel will need to post it to a pathology laboratory for HPV testing directly. Finally, the result of the test will be sent to their healthcare provider and will be reported to the personnel later. My inspiration for the prototype is the combination of telehealth and do-it-at-home kits for cervical screening in the UK. Telehealth is having a consultation with a healthcare provider by phone or video call, while cervical cancer screening needs a consultation before screening. Therefore, telehealth and cervical self-collection at home is the way to increase the screening rates during the pandemic world. The design principles are simple, innovative, and one-stop service. Simple is making the app easy to use with uncomplicated design. Innovative is applying the existing technology to satisfy the consumer by providing a mobile application for them. According to statistics, over 79% of the Australian population use a smartphone as of 2021, and it is estimated to reach around 80% by 2025. One-stop service is utilizing the AC product and service by combining telehealth and cervical self-collection together, providing any necessary process of cervical screening within one app. To improve the consumer experience, each framework is used to apply behavioral insights consisting of 4 elements which are easy, attractive, social, and timely. MedDelivery is easy to use and have uncomplicated design. It's attractive because of the one-stop service within one app. It also encourages family and friends to use together. And it brings the value of time when using the app so that the personnel can save the time while using the app. The prototype is desirable as it meets the consumer trend and market needs. Users can access the service at any time they are available. It also encourages participate in cervical cancer screening when it fits their time, which can increase the screening rates in the future. Furthermore, there are many specialists to select for the consultation within the app so that the user can feel satisfied and comfortable for the service. For the feasibility, the app establishing cost is around 50,000 to 80,000 Australian dollars. The annual maintenance cost accounts around 20% of the initial development, which are 10,000 to 16,000 Australian dollars. The forecast demand is around 1,500,000 users. The product is variable because it is able to be developed and scaled within the budget, and it could also leverage the existing resources which are telehealth and self-collection to be used. There are social and ethical issues for MedDelivery. For the social responsibility, it is designed to leverage the importance of women's health by providing the information about the cervical cancer. It also helps eliminate the barrier for cervical screening, especially for the cultural sensitivity. Using MedDelivery app can bring value of time as it has one-stop service for the user and help adapting themselves to the new normal life. However, there are risk factors for using this app. There might be contamination during the self-collection if the user is not well educated by the specialist. Besides, the risk for the result might occur as unclear, which it will be required for more tests later because of the mistake during the self-sampling. In summary, MedDelivery may be one of the solutions to help increase the participation rate of cervical cancer screening in the future. For today, thank you very much. I hope you enjoyed my pitching video.